Okay. Easy stuff. Tickles, easy stuff. Let's have a look here. Tura? Is that the way it's pronounced? Good job. Good job. Okay, I'm going to put a funny light on my head and look at your nose and mouth. Is that alright? Look at this funny thing. So it shines a bright light. Let me get my stool here. This is my nose looker. Doesn't hurt. And look in your mouth and let it easy to smell. Look in your mouth here first. Go ahead, open. Good job. Stick your tongue out. Say ah. Good. Just breathe. Go. Look at your teeth here. Do you brush your teeth at night? Good. Relax. Breathe. Go. Breathe. Go. Sorry. That's all. Okay. Let's look in your nose here. So this is a funny thing, but it doesn't hurt, okay? It's a little bit warm, but it doesn't hurt.
Okay?
Good job. Okay, I'm going to look one more time in your mouth. I'm not going to put anything in it. Just open real wide for me. Stick your tongue way out. Say ah. Good. Breathe. Go. Breathe in and out. Again. Go. Say ah. Okay. So at night, when he's sleeping, you say most nights you can hear him breathe pretty loudly.
Right now it's not true. No, because right now he don't have any allergy.
So it's more during the allergy season.
We have to allergy.
So
Have to
winter
time, especially winter time. We have to runny nose and something.
And when you put on medication, it didn't make that much of a difference for him, correct?
Allergy is not really much medication, but.
So this is what I see. When I look in his mouth and his throat. Sometimes for children they get a lot of snoring and breathing issues because the tonsils are really big and cause a lot of problems in this area here. But his tonsils are not really big. They're about average size. What we do see is that on the x-ray that he had previously, his adenoids are pretty big. So the adenoids are not here, but they're in the back of the nose. They're straight back. So the tonsils are here. They're not real big, but he's got pretty big adenoids. And so he does not have a lot of room in the back of his nose. And then if you probably add some swelling from allergies, it's going to make things that much worse.
Oh, yeah.
So that's probably the main issue, is his adenoids are enlarged and giving him some problems. And typically when you go on medication, it's not going to make the adenoids get smaller. There's not any real medication to make them get smaller. The allergy medication you take help decrease congestion inside the nose, but the adenoids really don't change in size too much. So he has big adenoids, and the nose gets more congested with allergies, so it gets really more of a problem. So from my standpoint, of course, I can't cure his allergies. I can't, do anything about that per se, but we can make his adenoids smaller. We can remove that. That gives him more room. So what I tell parents is that he'll still have allergies, but he should have a lot less symptoms from them because he has more room when he gets those issues. And that's kind of what they sent him here for you to talk about when I look at the notes, is that they tried him on medication, didn't make much of a difference. They did the x-ray, he's got big adenoids, so that's something that I think could be addressed. I don't think I would do anything about his tonsils and his throat. I don't think they're a problem.
No, it's not a problem. I think because I think especially when he have to allergy.
Yeah.
So I think the house also has fluids to carbac. So that's sure we have to make allergy for him.
Yeah.
So especially have to all the time have to summer and winter has allergy.
Yeah. So altering the environment can be helpful as well. So from my standpoint, an adenoid procedure is pretty straightforward. If we want to say remove the adenoids and improve the nasal passage, then it's a short procedure in the operating room. He's asleep under anesthesia. We would do the surgery right in the building across the street there. It'd be about 30 minutes, so less than an hour. He's asleep. We go through the mouth and get up to the back of the nose, remove the adenoid tissue.
tissue is how's this really big tissue?
Yeah, he's got big adenoids back there, so we would just remove that, but it's very straightforward. Like I said, it would take less than 30 minutes to do.
So this pain?
You know, the sore throat he gets afterwards is not real bad. Usually children get a sore throat for 2 or 3 days. Just take Tylenol is fine. They usually don't need anything stronger than that. When we do tonsil surgery, that is quite painful, but we're not doing that on him, just the adenoids. So the recovery is very quick from that, and expect that, you know, it should not affect his eating or drinking. But I think the benefit is that he'll definitely have a lot less of the chronic congestion and mouth breathing, especially during the allergy season.
Yeah, especially he has all the time allergy. That's why I have a concern. You know, allergy is all the time allergy. What we can do, nothing.
Exactly. So what I can do is make the nasal passage more open. But once again, I'm not going to stop his allergies, but he should have less symptoms because he has got more room in his nose. Does that make sense?
So how about if he has allergy, have to nasal spray, have to stay using this, all right?
It's fine to use it. Does it help him a little bit?
Yeah, this helps.
Yeah, if it helps, I would stay on that. And it doesn't make a difference for our surgery. We can do the surgery any time, but I think probably doing it before it gets really bad during allergy season probably would not be a bad idea.
So okay, if I need to operation, so because right now so he's okay right now.
Yeah.
So
your concern is that, but you know what's going to happen during the allergy season and things like that. Yeah. So I mean, it's you know, in some sense, it's up to you. I mean, from his history, it sounds like it definitely would benefit him. If you want to wait and see what happens, that's fine. But it sounds like you'll probably get more problems during the winter time.
how about if this tissue is come to big or?
I'm sorry.
This tissue has well, some positions to change. So for example, sometimes the tissues come to big the same day.
I'm sorry, what tissue?
Because he has a nose has some tissue is big, right?
That's the turbinate, yeah.
This one's come to big or not?
Right now his turbinates don't look big, but definitely during allergy season they definitely can get big. There's some people who have big turbinates all the time, and we'll sometimes do a procedure to make them smaller. Usually in someone his age, I'm pretty conservative. I probably would not recommend doing much in the way of procedures inside his nose. The adenoids is pretty easy to remove, but the turbinates, I probably would not address that right now at his age.
Okay. How old have need to remove this if have to need it?
The turbinates? Well, it kind of just depends. I mean, you know, I'm thinking the adenoids alone will give them a significant benefit because I don't see a lot of turbinate enlargement right now. You know, now it might be a different story in the wintertime, but I'm hoping just with the adenoid procedure alone that'll make enough difference for him. You know, in a couple of years if he still has problems, certainly we can always address the turbinates if we need to. But I'd like to probably see him a little bit bigger before.
How to call it right now is a need to operations of what kind of
procedure? It would be to remove the adenoid tissue in the back.
Adenoid tissue.
Yeah, in the back of the nose. I mean that's what we see on the X-ray. So.
Adenoid tissue is he has a little bit in normal people.
He's got enlarged adenoid tissue.
How large? Is it really dangerous or?
Well, it's not dangerous. I mean, all of this is to help his breathing.
Okay.
And so, you know, the reason you're sent here is because he seems like he wasn't getting that much better with medications.
Okay.
So, you know, certainly it does not have to be done, but it's one thing I think that would give him benefit if you remove the adenoid tissue.
So, then I think I need to wait for this winter time. So if I have to stay back to winter time, so maybe next summer I need to remove it better.
So you want to wait for a while?
Yeah,
okay.
Because he's really best this last winter and summer, because all the time have to allergy.
Yeah.
So that's why I have a concern. So allergies now is a little bit, not too much, but still have allergy, right?
Yeah, I mean he looks a little congested, but I mean, you know, if you think he's better at this point, you would sound like you would just rather wait and see where things go.
Yeah.
That's fine. If he gets bad in the wintertime and he's not, you know, improving with medication, certainly bring him in and we can, you know, talk about it that as well. Okay?
Okay.
Okay.
Thank you.
No problem.
Thank you so much.
Wait here for just a second. Let me get my nurse to get to you.